Dostal. I'm a registered dietitian and a certified diabetes educator. I like to work with people to show them how their food intake impacts their health.
I was diagnosed with severe hypoglycemia, and my doctor was concerned with my weight and putting on a few pounds, and I was having many episodes with my blood sugar. So a good friend of mine, I've been asking around and no one could really tell me where I should go or who I should see. And a good friend of mine referred me to Julie, and so I started seeing her about 4 months ago. And it's been a godsend. I was having 3 to 5 episodes per day, miserable, didn't even want to work or leave the house because my blood sugar would just keep dropping so fast. As I was coming to her, they kept getting more and more gradual. And she just, as a person, what she does is amazing. She's very caring and kind, listens to anything you want to say, talks about whatever, very patient, and very knowledgeable in what she does. And now it's been 4 or 5 months since I've been seeing her, and I'm down to maybe 1 or 2 episodes per week.
I was diagnosed with type 2 diabetes a couple of years ago, and actually found out when I was doing a routine exam to acquire life insurance. But I met Julie at a women's health fair, and she had a booth that allowed me to put in a name to be contacted for diabetic education.
I offer classes for diabetes education. They are approved by the American Association of Diabetes Educators, so it's a recognized program that Medicare reimburses. We have 4 class sessions, and what I really like about my curriculum is that it gives my students, my participants, a chance to apply their knowledge. It seems like my clients come in with a fair amount of knowledge. We test them when they come in the door with a knowledge test, but they don't really know how to apply it. They don't really know what makes their blood sugars go up and down. They don't really know what foods to eat or how often to eat. What does exercise and stress do? And this class does an excellent job of making them aware of the changes that they can make in their own lives day to day to help manage their blood sugars.
The more education you have, the better you can do, as long as you implement. And so in doing that and understanding what I needed to look for, it really helped me to make sure that my numbers were in range. So I understood better how food affects your blood sugar level, and why it's so important to make sure that you're eating throughout the day. In fact, one of the things I did discover throughout the classes, my numbers were relatively good. And with improvements in my lifestyle, I really do think I can turn this thing around. So I don't have to be diabetic type 2 classification forever. If you're wanting to manage your diabetes or working through any health issue, I would strongly recommend that you contact Julie Dostal. I think she has a program that would help you.
I work with about 5 different categories. I work with weight management and pre-diabetes, diabetes. I work with heart health, both blood pressure and cardiovascular disease, and then as well as eating disorders. The most common misconception is the inability to recognize how important changing their food habits could be. Some people want to maximize it, think it's everything, and that is not the case. And some people want to dismiss it, saying, oh, it won't make any difference. When by and large we see that changing your food habits can really change the way you think, feel, and operate.